Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today we're talking about interoperability, structured data, and ambulance workflows. I've got Stacey, Clifford, and Chris Roll from Daedalus with me today. G'day team, how are we going?
Good, thanks, Peter.
Always great to have a conversation with the talented folk from Daedalus. There's previous episodes in the feed. I think you both featured at some point in different forms of content on the Talking HealthTech podcast, sometimes about interoperability, sometimes about amPHI, which we'll get into, and the ambulance side of things. But I'm keen to kind of contextualize that a little bit more and put it into frame for the current climate and the issues you're seeing and the problems you're solving. So firstly, maybe Stacey, I'll go to you. Help me set the scene. Tell me about amPHI and that platform and how it's being used in the pre-hospital space.
Sure. Well, I guess firstly, what amPHI isn't, it isn't just a digitisation of paper form or a paper record. It is far more connected in electronic medical or electronic patient care record used within the ambulance that covers the entire chain from the dispatch call right to when the patient's handed over at hospital or the episode is resolved. It live streams data between the responding units. So it's a single patient record that anyone that's assigned to the record has access to, as well as that data being live streamed to receiving hospitals. So they have early visibility of the patient's status and the care that's happening within the hospital to allow them to better prepare for what's coming or coordinate with other services within the hospital, theatre, cath lab, that kind of thing. It focuses on structured data within the record, which we're going to touch on a lot more during this discussion. It integrates to point of care devices within the ambulance, so it decreases the free text and the actual data entry that ambulance officers have to do when they're looking after a patient. And most importantly, and tied to what we're talking about today, this conversation, is the data mining possibilities, not just for operational reports, but for clinical review of the patient care and like what they did to the patient and how could they improve next time or what worked really well, those kinds of things. Having that data available really helps, overall looking forward to future healthcare.
Yeah, love that. And look, there's a previous episode in the feed that people can go and check out. We'll try and link that up in the show notes. I believe, Stacey, it was you, me, and Soren on your side, and we did a bit of a live episode, and we did a bit of a dive into what that platform is. So thank you for setting the scene. I also appreciate the extra sound effects you provided with a ambulance siren in the background, but maybe our fancy post-production might mute that out, so that won't have any context for an audience member. But either way, that's good to hear. Look, Chris, we've got you in the conversation as well, and if I think Chris Royal, I think in the data, the interoperability, the connecting bits and pieces together. So, talk me through this problem we're trying to solve here on the interoperability side. Why is it relevant in this discussion around pre-hospital care?
Yeah, certainly in the past, the ambulance context only really had the information that the computer-aided dispatch team would use based on the conversation they're having with the patient over the line. But more and more, it's important that they have access to information on their way to the scene. What other context do we have about this patient that we can use to make a better assessment, a faster assessment of the patient when we arrive? So information from previous visits is obviously important, but it's also important to gain access to the full health record. What information can we gain from the likes of My Health Record through some better integration through to that source, as well as sharing the information that happens pre-hospital with other care providers, whether they be the GP when they go back to see the GP, or the hospital receiving the patient at the end of the day. And it's not just, as Stacey said, it's not just digitising a paper record, but using common terminologies that we can then make better use of in that care through things like decision support, but also being able to use it for reporting means getting that common terminology and common meaning of the data.
Yeah, that all makes logical sense to me, and I like the cleanliness of having data all kind of lined up and coded, so then we can kind of look back through a patient's care. Stacey, if I went to, from your experience and just what you're seeing on the clinical side and what the real world sort of looks like too, I guess if I was to put myself in the shoes of a first responder or a paramedic in a scenario where they arrive, like, how much are they really kind of yearning the need to look through a bunch of information before responding to a patient? I kind of, like, from my non-clinical experience, I think about where you kind of arrive on the scene, you kind of stabilize, you get them into hospital, and because you don't want to burn a bunch of time for a paramedic looking through a bunch of files and looking at, well, who am I dealing with here? Is this right? Oh, this button doesn't work. So you don't want to front end load a lot of admin on say a paramedic. How do you think about building out this,
Yeah.
amPHI specifically to address all of those?
Yeah, so I guess there's 2 points to that question. Firstly, giving the paramedic that history enables them to better assess what's happening with the patient. You could come across someone who has an altered level of consciousness, but that may be due to a medical condition. It could be due to a trauma condition. So having some background, are they a diabetic or do they have epilepsy, those kinds of things, having visibility enables them to better understand or think, it's more likely to be this than that. Presenting that in a way that's clear and concise for them, the way that amPHI displays it, it displays it under a standardized sampler template. So allergies, medication, previous illness, and it provides it in date range so they can look at it and either include or exclude. So it comes across as standardized text, very clear, and that it's a simple press button to include it in the record or not, because it may or may not be relevant to why they're turning up to the patient today, but given good visibility to, that holistic image of the patient, what are we really dealing with here?
Yeah, and I guess then you've got the other side of the coin too. Once a patient's been received into a type of care, and like you say, you want that visibility for a treating clinician to be able to see, well, what happened on the way or once received, and the notes, I guess, from the paramedic. What does that look like now in terms of like that kind of information that a clinician might receive and the value they might place on that, or the weight that they would place on that information? And look, why is it important then to make sure that the paramedics are putting in structured data? Because when I think, oh, let's make sure paramedics are putting in structured data, I think, well, that's more stuff they got to do kind of on the road. Walk me through how you kind of factor in
Yeah.
all that.
I guess the benefits of structured data are twofold. So one, it's ease of documentation. There's a decrease in free text. So having to type if you're in the back of an ambulance or if you're in a helicopter bouncing around, structured data is much easier if you've got to hit a button. It's not having to decipher what someone's trying to say. So one of our we have a paramedic that works with us in the Danish office, and he's a current paramedic as well. And we spoke at the CAA Operations Committee board meeting earlier this year, and we were talking about why we want to use standardized nomenclature and structured data within an ambulance record. One of the studies they did, they found, is a Scandinavian study, they found there was about 40 different ways that you could describe stroke. So free text or medical acronyms or those kinds of things. So if we're looking at using standardized nomenclature, and in amPHI we're looking at SNOMED CTAU, we're getting clarity of the patient condition, we're getting consistency in documentation for reporting, and then we also have that ability for interoperability on top of it. So I guess that's the benefit really. It's the ease of documentation and the clarity of what's going on.
Yeah, that makes sense. And so, Chris, looking under the hood on the data side and the standards, I guess, for a moment. I think we were talking prior to this conversation, and we were looking at how amPHI's gone straight to fire. Is that right? Because there's a few different options when it comes to looking at standards and structure of data. Talk me through what that looks like behind the scenes.
Yeah, being the fire guy, I'm kind of happy that we did go straight to fire and skipped out the whole V2 part of the puzzle. And it does make sense in the way that the project and SA Ambulance are working, in that we don't necessarily want the full population of South Australia to be preloaded into the ambulance. When a patient does get called into the service, so someone calls for an ambulance, we can then at that point do a fire lookup, do a search against the repository to bring back the patient demographic details into the amPHI solution. And as you say, it's all based on fire. But not just the patient record, but things like allergy intolerances, previous encounters, all that information can be fed and available to the paramedic in real time.
Yeah, that sounds useful. And Stacey, this is being used in the real world in Australia now, and Chris touched on South Australia. For those unfamiliar with that implementation, tell me where we're at kind of now with it, and any feedback or perspectives from clinicians that are using it real time.
Yeah, so a project's kicked off this year, going really well, targeted for a go live next year. So that'll be really exciting. Yeah, they're looking at a lot of, they're moving from paper. So it's really quite exciting, one, to move from paper to a digital platform. But then they're going to have the added benefit of a lot of those, as Chris talked about, those integrations and that early visibility to the patient histories, to be able to get, a great view of what's going on right now. From paper, it's very hard to translate that from one record to another. So there's multiple records that are happening at the moment. If there's multiple legs of that care, with amPHI, it'll be a single patient record with consistency of data across that single patient record, visible to everyone involved.
Yeah.
I think the exciting thing is that we are going to be producing a patient event summary that will find itself into the My Health record. So we're not only just having the ability for paramedics to view data that's in the My Health record, but really participating in that patient's care record more broadly. And I know that the team in South Australia is excited to be able to provide data into the My Health record, and we're doing our part in that.
I guess if I was in my usual member of the public and an Australian taxpayer point of view, if I saw something come up in my Health record about an ambulance thing, I'd be like, my mind's blown, But it's the small things that'll be a big impact, and it's important for that continuity of care piece. And I guess in that process of implementation, getting ready for next year, getting that buy-in from paramedics and the teams in, I guess pros and cons, right? Or at least new challenges that are faced, because if everyone's been used to doing it for a long time, there's when you're doing stuff on paper, whilst it may seem faster because that's the way I've always done it, you're kind of just pushing the problem further down the line, right? And we know that there's a lot of other problems in healthcare that we could probably be dealing with, and if we can, I guess, get that training and buy-in and all the implementation people culture stuff, I think is going to be super important. So I imagine that's front of mind for you, Stacey.
Sure is. Look, they're incredibly excited. They've waited a really long time to move to a digital platform, and they're incredibly engaged and eager to embark upon this.
Yeah. And hey, look, I think about this is very. I think about the discussion more broadly in the ecosystem, particularly in Australia when it comes to health data, and we see all of the anticipation around interoperability and fire, and there's the stuff happening with Sparked, and I know, Stacey, earlier in the year you were in Adelaide and sharing some of that as well with that community. Chris, for you, I mean, there's a lot of anticipation, but then also we've heard of plenty of examples of this is the intention, but then a thing finally happens and it kind of falls short. Where do you see, I guess, the biggest misconceptions or misalignment when it comes to interoperability in healthcare, and why kind of some of these projects have the best intentions but fall short?
Yeah, it's a great question. I think what I hear a lot is I've kind of done my fire thing now, or I've implemented fire now, my job's done, or
Mm.
fire's that silver bullet that's going to solve all my interoperability problems. And that's not the case. It's got to be combined with a bunch of things. Alignment to a profile. So the work that's happening in Spark now around the AU core, um, some of the standards that relate to that around patient summaries. The fixing of terminologies aligned to those profiles is really important. So although I might conform to FHIR from an international perspective, my ability to conform to profiles and standards in the terminology space is really important when we're trying to share understanding between one provider and the next. Some of the misconceptions are that once I've got the format from a FHIR perspective, I've got a JSON document, my job is done. Really, the hard work is getting that shared nomenclature that we can use to do things, smart things like decision support on those codified terms, but also sharing that information, sharing that understanding from one care provider to the next. If we are wanting to engage GPs, bring them into the journey, then we've got to have that shared knowledge, that shared understanding, and terminology helps us with that.
Yeah. And I just think with Daedalus and the reach that you have globally, this is obviously not the first implementation of amPHI across the world. Maybe if we reflect on some of the conversations previously, Stacey, some of the can you share any of the benefits and successes, or like how you've seen the product kind of evolve in other parts of the world that might be able to then be implemented here in Australia?
Yeah, so I guess the digital maturity that they have in Denmark is really showing in their ability to really produce some interesting studies about pre-hospital care. One that has just recently been published was really interesting about the requirement of oxygen to trauma patients, and they're really looking at liberal oxygen provided to patients, trauma patients. Is it really required? They found it in a lot of cases it isn't. So it's having that digital maturity, it's having that quality database to be able to draw upon and really look at how we can evolve healthcare, what's working, what could we, do better.
100%. Look, as we start to close out this conversation then, and we've got, that framing around amPHI and what it can do in that pre-hospital space, the importance of the standardized data, I think we've kind of encapsulated then too that it's not just about getting the data tidy for the benefit of all involved internally. Sounds like what you're saying, Stacey, as well, is that once you've got that data together, you can then do interesting things with it to then inform future patient care. But it sounds like it also benefits the patient that's being treated in real time, as well as the potential future ones too. I guess if you were to close out, what would be your kind of vision for as this scales out, how else this kind of benefits the ecosystem more broadly?
Well, I guess really as I said, creating that quality database for that pre-hospital service, so they can assess, monitor, improve what they're doing in that pre-hospital space. That could really have positive impacts on patient outcomes once they're an inpatient, or it could potentially reduce hospital stays and or support hospital avoidance programs. We know that ramping is a massive problem now, and hospital avoidance is a really key way to help relieving that pressure on ED and reducing those rampings.
Totally. And Chris, any other final thoughts from you?
I think it's exciting as we bring pre-hospital into the age where it can share information more effectively with GPs. Myself as a patient, if I have an ambulance attendance, I want that information to go back to my GP so that when I go and see them, then they're better informed and can help me in my health journey, as well as proactively call me in. Hey, I noticed that you've had a an ambulance attendants. Let's have a chat about how we can help you more effectively. And being a techo guy, I'm kind of excited that we're using some of this technology for what it's meant to be used for. Better sharing of information, feeding into things like decision support that can then turn into better effective use of that data.
Yeah, it is a really good application of it, isn't it? In a part of healthcare that probably needs it the most. And I guess myself, from a patient's perspective, I'm excited about getting some kind of correspondence about any kind of ambulance attendants I have that isn't just an invoice in the post that I receive 3 or 4 weeks later. So that's my final reflections on that. Look, Stacey, Chris, I really appreciate you making the time for this conversation. All the details for Daedalus and previous episodes will be in the show notes of this episode on our website, of course. So I really appreciate you making the time today. Thank you so much.
Thank you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.